Happy Motivational Monday. Hi, it's the nursing professor. And today I want to talk about the occupational health nurse, which is also an alternative to acute care setting. Again, not trying to move you away from the bedside, but just giving you a little more information about what various roles in nursing, how they actually perform. And so the occupational health nurse works in various settings. We're probably most familiar with that person working in a hospital setting where they take care of, thousands of employees. They're responsible for things like infection control and communicable diseases, if we get needle sticks, looking at trends like back injuries and things like that impact employees, as well as ergonomics. So we're probably most familiar with that. But an occupational health nurse can work in other settings. For example, university settings. Yesterday I got notice from our occupational health nurse and that we need to go back to wearing masks because there's been an uptake in COVID in our area. Also during COVID, I worked for the metro system here as an occupational health nurse, and we were responsible for making sure that the bus operators and the train operators were really ready to return to work. Education, of course, on how to help them avoid some of the communicable diseases and things like that. One of the places that you might not be aware of is that typically there is an occupational health nurse who works in Congress. And so whenever Congress is in session, then there are occupational nurses that are also present there. They typically also run a health clinic where the congressmen and the senators and their staff can come in. If they have a headache or cold or flu, or maybe they have an injection that has been prescribed by their physician and they need some help in actually receiving that medication. Allergy injections and things like that. And that was a pretty fun and exciting job, seeing people who we actually see are the lawmakers of our society, at least they used to be. Sorry about that. But it was really exciting to see some of them as people, because the truth is this, is that all of this, we're people first and then these jobs come afterwards. So education, the minimum education for an occupational health nurse is a BSN. You will find that if you get certified in occupational health, which I would recommend because there's so much that really goes into that as far as surveillance and things like that we're just not used to doing as an acute care nurse. Salaries are anywhere from about $80,000 on up, depending on where you work. Hospital settings typically pay more because you have such a large volume of healthcare workers that you have to take care of. You're also responsible for education. So if you notice that there's a trend in something, for example, like the occupational health nurse in my university yesterday noticed that there was an uptake in COVID, then she sent out a reminder of how to protect yourself, how to stay home if you have symptoms, how to wash your hands, how to wear your mask, how to stay some distance apart, and things like that. So that really does help prevent some of the occurrences that can exist. I think that is about it. But if you have any questions about occupational health nursing, please put them down below because I'd be more than willing to answer them. And if you like this video, please thumbs up, share, because if you're not interested, then there might be someone else who is interested in just knowing a little bit more about these alternative roles of nurses that are outside of the hospital. So I hope that helps. I'll see you next video. Bye for now.